What a shame it is not possible to do an immediate comparison today, because it's different. It's different.
Yeah.
Some of it's different.
I think it's not going to change. It's not going to show anything dramatic. Even though you're feeling better, I wouldn't expect the scan. It's only 10 days ago. It's
Yeah,
not going to
yeah,
be dramatically different.
But I'm feeling dramatically different.
I
That's
know,
the-
I get that. Yeah.
But occasionally
And I
not.
wonder. He says that with lots of lung conditions, when there's full of phlegm and mucus and dead bits of lung, if you like, and sort of
Yeah.
in really very inflamed and very damaged bits of lung tissue, you get lots of inflammatory cells there, lots of pus and damaged bits of material.
Right.
And with lots of our lung conditions, when there's lots of damage to the lung, lots of phlegm in there, clearing it out is often the best strategy.
Uh-huh.
The inflammatory cells that cause the sputum and the phlegm and the muckiness to be there, by being there, that causes more inflammation. So often by clearing out that process, the amount of inflammation goes down. You've coughed out a lot of the bugs that are causing the problem. So I wonder if that's partly why. There's no other reason. The scan itself wouldn't cause any
Okay.
reason to be any better.
I'll tell you this: whatever it is, it's got a bitch of a sense of humour about it. You know, one minute it makes you think, "Oh, yeah, I'm getting better," and the next minute it'll take you back down big time. And it's got a wicked sense of
I'll
humour.
listen in.
Um,
At the front, first of all, if I may.
shall I pull this right up?
Right up would be good, yeah. Your chest sounds relatively clear.
It always has. It always has. It's only at certain times of the night, let's say, when I'm in a certain position, that it'll start doing the noise. There's none of
That's
this.
also very typical of infections like fungus, fungal infections,
Right.
things like TB, things that are more slow growing,
Okay.
or indolent infection as we might call it, sort of slow growing and gradually.
And of course, antibiotics wouldn't tackle a fungal infection, would they?
No, but it's a reasonable first. Simple chest infections are the most common. Things are common. So I don't think it was unreasonable for your GP to try to do that in the first instance.
And they hit them again with harder ones when I went to the hospital.
And that's very common. This is our general strategy.
But again, there was no noticeable difference.
No, and that's important to note.
I imagine if they were going to work, you'd notice it within like a day or so of commencing the tablets. Is that
48 hours is 48
Yeah,
to 72 hours.
there was no effect. There was no effect.
And I think it's good to have tried that. It suggests it's not just a simple infection. If this was standard pneumonia, you'd have been dead weeks ago.
Really?
So it's clearly a different funny. It's a funny bug
Okay.
or something else funny going on.
Okay.
And for that reason, we used to do a camera test.
No.
Something called a bronchoscopy.
I got to be awake for that. I'm going to have a hard time with that.
And you're not the first person to say that or worry about it. That's the first thing I'll say.
Swallow the camera. That's.
Have you ever had this done before? Or
No.
Can I take you through the procedure? I think it's the only way we're going to manage to get some extra answers.
When you drug me up, am I so happy that I don't care?
You're very sleepy, so you don't care.
Do I really not care?
Most people don't. Some people cough. We've got a drip in your hand. We numb the back of the throat with some spray.
If it's got to be done, it's got to be done. But I'm going to have a hard time with that.
That's
Christ,
fine. And we've got a
I'm
cupboard
really
full.
not
We've got a
well.
cupboard full of sedation to help you tolerate it.
Yeah.
We've got some medicine that we use two medications. One makes you very sleepy,
This is my next hurdle.
and one of you, and that same drug makes you not necessarily remember the procedure. The second medication we use, again, makes you sleepy, and helps with reduces the cough sensation and the cough reflex.
This is in and out in a day, or
So it tends to be, we let you go home the same day if there's someone who can be with you overnight, which might be
so I won't be driving myself, will I?
No.
Okay.
Unless you came in the morning, parked and paid for overnight parking and whatnot. So if there's no one at home or if no one can be with you, which
No.
it sounds like would be you, we tend to bring you in overnight.
I would be resistant to that for the dogs.
I appreciate that, and that's why I wanted to tell you now. I don't have an easy solution. We either have someone who can stay with you overnight, or we bring you in, or we can do it without any sedation at all and you're wide awake. These are the three options, really.
Let's pretend I got somebody at home. Let's go that route. I can probably arrange that. I'll get somebody.
We would need you to have someone with you.
I'll get
because it's a safety perspective, because the medication makes you quite dopey,
I'll arrange that.
and we're quite heavy-handed with it often.
Okay.
So,
Let's just do what's got to be done.
yeah. Okay, so I'll make arrangements for that. And
My,
the assumption
my,
that you'll
my,
have
my,
someone-
my current attitude, look, I explained to you, I have a dependent, the dog. I need to take care of that. My current attitude coming here today was, look, if you were going to say cancer, I was going to say, right, what treatments are available? I might not want to bother.
Yeah, that's
That's my mindset.
Yeah.
Life hasn't been so good.
My suspicion is
So
that
I'm
you
good
guys,
to go. I'm good to go.
and as I said, cancer's not screaming out on top of this. It's definitely on the list of things it could be.
Okay.
If this was all cancer causing that much inflammation and damage to the lungs, I would expect you to be quite a lot sicker than you are
Right. Yeah.
and have lost a lot more weight.
Right.
If I was a betting man, I would go with some odd type of infection.
Okay.
Yeah, I think an odd type of infection is probably
All right.
high on the list.
Okay.
There's some blood tests that I would quite like to do that haven't yet been done. I know you had a whole panel of done along the way. I think it would be handy to update those. Would that be all right?
Yeah. Absolutely. Yeah. I'll tell you one of my biggest disappointments was that in the blood tests that have been done, they have not tested to see if I have ever met COVID.
Yeah.
I would love to know.
COVID swab when you came in.
I wouldn't be active after all that time, would I? I wouldn't be.
No.
But I would like to know if I've ever met it in the past.
And you'll need a COVID swab before you come in. In terms of antibodies, I don't have access to that here in this setting, as it were. If you're coming into hospital, we would be routinely doing it for admissions, because that's just what we're doing. I can request it on the form, but I'm not sure the lab would process it. And COVID, there's no suggestion on the tests we've done so far that COVID doesn't do this to your chest, basically.
Okay. All right. We'll rule out COVID then. We'll rule that out. Okay.
So you don't have COVID, and it doesn't look like COVID is a...
Okay.
Yeah, and if COVID had done this to your chest, we wouldn't be having this conversation today.
Right.
Yeah.
Okay.
Now, because this looks like some kind of serious infection, or unusual infection, I think we need to make sure that your immune system's working as it should.
It's some bronchial thingy.
Bronchoscopy, yeah.
Is that just going in to look, or are you grabbing bits?
Mainly to look. We do sometimes take biopsies if we see things that look abnormal.
Okay.
Typically, based on we scan, what I would suggest we would do would be we pop the camera in, go through the nose.
Oh.
So you put some slippery anaesthetic gel in the nose.
Okay.
And we put some spray in the back of the throat that numbs it. And we pass a very thin, it's probably thinner than that actually, down through the voice box and into the lungs. And we squirt some salty water into the top of your left lung, suction that back again, and send it off to the lab.
Okay.
That's all I'd intend to do.
Right.
So it's quite a quick procedure.
Okay.
We do sometimes do biopsies if the lining of the airways, the breathing tubes, looks abnormal or irregular. We can take biopsies,
Okay.
which we can test for cancer and that kind of thing. The washings that we'd send to the lab looking for all these types of infection. And we would also look for cancer cells in the washings.
Mm-hmm.
But we wouldn't anticipate doing any biopsies unless there's a specific lump that
Right.
we take a biopsy of. We don't just take blind biopsies, it's not particularly
Okay.
helpful.
Okay.
Does that make sense? Do you have any
Yeah.
questions?
No, I don't think I do.
The next step is to do the camera test.
Okay. I'm disappointed, but okay. Okay.
We know you've got quite abnormal lungs, and that's taking us forward. So there's no big solid lump that
Okay.
looks abnormal.
Okay.
And as I say, based on the scan, cancer's probably slipped down the list a little bit.
Right. Okay.
An odd infection, I think, is probably top of the list.
Given your experience, vast I'm sure it is, if this is what you feel it may be at this point,
Odd infection.
an odd infection, well, where does that go in the...
So step one, we don't want to rush in and treat it with the wrong drug that will
Yeah.
cause it to be resistant or cause side effects and problems.
Right.
Step two, depending on the treatment, it's going to be a long course of treatment.
Right.
If it's fungal, we've got lots of antifungals.
But it could be a happy outcome?
We'd expect there to be, significant improvement, and you're probably going to have some scarring left as a consequence of this. And your lungs may not return to normal.
I'm prepared for that.
But that's not to
but
say
where
that
I am today, if...
I'd anticipate, depending on if we can identify the bug and what we think is going on, if the blood tests give us some clues, then I anticipate that we can make some progress and
Oh, really? Okay.
improve things.
That's, we'll take good news then, eh?
Yeah.
Okay. Okay.
I don't want you going out here rehoming your dog because you think you're about to drop dead of cancer.
Good.
Infections can be very severe, and if this were to escalate further or not to respond to treatment,
I've been through the worst of it. That's how I'm feeling. I
Yeah.
have come up
Yeah.
since the CT date.
Yeah, no, I get that. Yeah.
So
And that's not to say there might be some speed bumps on the way.
I absolutely prepare for it. Like I said, it's got a wicked sense of humour.
Yeah,
But I've been through hell. I've been to hell and
I can
back.
tell that.
I thought I was gone. I thought I was a goner.
Fine. So here's some blood tests that we need for your bronchoscopy. There's a whole raft of things on here looking for
Right.
primarily the sort of the fungal blood tests, which we haven't done yet.
Okay.
Also looking at your immune system. The other thing I'd always do for patients with odd infections is an HIV test. Are you
Okay.
happy for me to do that?
Okay. Yes.
Most unlikely, but if we don't look,
Yeah, for
we
sure.
sometimes get surprises.
So what am I now doing?
With that, I'll go find out with the nurses if the phlebotomy lab. Just go out that door. Leave that there.
Somebody's going to tell me what to do, yeah?
Yeah.
And come back here for another day for a blood test if you can't get them done today.
Okay, thank you very much, thank
We'll
you.
catch up probably at the bronchoscopy.
Right.
They might be doing it.
Okay.
Depends on I'm not always here. Otherwise, we'll catch up in clinic in a few weeks.
Thank you very much.
Right.
Thank you.
So you can get them before we go.
Oh, I've got to turn this off. Right, I just paid me ticket, £2.50 that was, £2.50. We're out of here because the flipping place I'm supposed to give blood is shut already. So I'm supposed to come back here tomorrow at some point, anytime, and give blood somehow. Flipping heck. Flipping heck. I should be grateful. I don't feel it. I shall be heading home.